Picture this. You're finally ready for a peaceful night's sleep, but just as you settle into bed, your bladder sends you that familiar signal. You make the trip to the bathroom, return to bed, and within an hour, you're up again. This cycle repeats itself throughout the night, leaving you exhausted and frustrated the next morning. If you're over 60, and this sounds painfully familiar, you're not alone. Nearly 70% of people in our age group experience frequent nighttime urination, and what most don't realize is that 3 simple nuts sitting in your kitchen right now could be the key to transforming your sleep quality forever. I'm Dr. Fernando Manocchi, and after 15 years as a cardiac surgeon and now helping thousands of people through health education, I've discovered that some of the most powerful solutions for our health challenges aren't found in prescription bottles, but rather in nature's pharmacy. Tonight, I want to share with you a discovery that could change your nights from restless interruptions to deep restorative sleep. The connection between what we eat and how our bladder behaves at night is far more profound than most people understand. Think of your bladder as a sophisticated balloon that's controlled by an intricate network of muscles and nerves. When this system becomes overactive or inflamed, it sends false signals throughout the night, disrupting the sleep your body desperately needs to repair and regenerate. But here's what's truly fascinating. Recent research has shown that certain compounds found in specific nuts can actually calm this overactive bladder system while simultaneously promoting deeper sleep. These aren't just old wives' tales. These are scientifically backed findings that are revolutionizing how we approach nighttime bladder control and sleep quality. The first challenge we face as we age is understanding why our bladder seems to develop a mind of its own at night. During our younger years, our body produces higher levels of antidiuretic hormone, which helps concentrate our urine and reduces the need for nighttime bathroom trips. As we age, this hormone production naturally decreases, meaning our kidneys produce more urine during the night hours. Additionally, the muscles surrounding our bladder, much like the muscles throughout our body, begin to lose some of their strength and coordination. Imagine these muscles as a well-trained orchestra that's been playing in perfect harmony for decades. As time passes, some musicians might miss a note here and there, and the conductor, in this case our nervous system, sometimes gives mixed signals. But there's another layer to this puzzle that many people don't consider: inflammation. Chronic low-grade inflammation in our body can affect the delicate tissues of our urinary system, making our bladder more sensitive and reactive. This inflammation often stems from our dietary choices, stress levels, and even certain medications we might be taking. Now, you might be wondering how something as simple as eating nuts before bed could address such a complex issue. The answer lies in understanding the remarkable compounds these specific nuts contain and how they interact with our body's systems. Let me share with you the story of Maria, a vibrant 68-year-old patient who came to see me last year. She was getting up 4 to 5 times each night, and it was affecting every aspect of her life. She was exhausted during the day, her mood was suffering, and she was worried about the long-term effects on her health. After trying various approaches with limited success, we explored the nutritional route, and the results were truly remarkable. The first nut that can transform your nighttime experience is the humble walnut. Now, before you dismiss this as too simple to be effective, let me explain the science behind why walnuts are such powerful allies for bladder health and sleep quality. Walnuts are one of nature's richest sources of melatonin, the hormone that regulates our sleep-wake cycle. But here's what makes this even more interesting. The melatonin in walnuts is in a form that's easily absorbed by our body, and it works synergistically with other compounds in the nut to create a calming effect throughout our system. Think of melatonin as your body's natural sleep conductor, orchestrating the complex symphony of processes that help you fall asleep and stay asleep. As we age, our natural melatonin production decreases significantly, which is one reason why sleep becomes more elusive. The melatonin in walnuts helps restore this natural rhythm. But walnuts offer something else that's equally important for bladder health: omega-3 fatty acids, specifically alpha-linolenic acid. These healthy fats have powerful anti-inflammatory properties that can help reduce irritation in the urinary tract. Remember that chronic inflammation I mentioned earlier? Omega-3s act like nature's fire department, helping to calm inflamed tissues throughout our body, including those delicate bladder muscles. Walnuts also contain magnesium, a mineral that acts as nature's muscle relaxant. When our bladder muscles are tense or overactive, magnesium helps them relax and function more normally. It's like giving your bladder muscles a gentle massage from the inside. The second nut that could revolutionize your sleep is the Brazil nut. Now, I know Brazil nuts aren't everyone's favorite due to their size and rich flavor, but the benefits they offer are truly extraordinary. Brazil nuts are the world's richest source of selenium, a trace mineral that plays a crucial role in reducing oxidative stress throughout our body. Think of oxidative stress as rust forming inside our cells. It damages tissues and accelerates aging. The bladder, being a muscular organ that's constantly working, is particularly susceptible to this type of damage. Selenium acts like a powerful antioxidant shield, protecting our bladder tissues from damage and helping them function more efficiently. But here's where it gets really interesting. Selenium also supports thyroid function, and a healthy thyroid is essential for proper hormone balance, including those hormones that control urine production at night. Brazil nuts also contain healthy fats and protein that help stabilize blood sugar levels throughout the night. When our blood sugar spikes and crashes during sleep, it can trigger the release of stress hormones that stimulate urine production. By keeping blood sugar stable, Brazil nuts help maintain that peaceful, undisturbed sleep we're all seeking. The third nut in our nighttime arsenal is the almond. Almonds might seem ordinary, but they're packed with compounds that directly support both bladder health and sleep quality in remarkable ways. Almonds are rich in tryptophan, the same amino acid found in turkey that makes you sleepy after Thanksgiving dinner. Tryptophan is a precursor to serotonin, which then converts to melatonin in our brain. This creates a natural cascade of calming neurotransmitters that help us drift into deep, restorative sleep. But almonds offer something unique for bladder health: they're alkalizing. Our modern diet tends to be quite acidic, and acidic urine can irritate the bladder lining, making it more sensitive and reactive. Think of acidic urine as sandpaper gently rubbing against the inside of your bladder all day long. Almonds help neutralize this acidity, creating a more comfortable environment for your bladder. Almonds are also rich in vitamin E, a powerful antioxidant that supports the health of cell membranes throughout our urinary system. Healthy cell membranes mean better communication between our bladder and our brain, leading to more appropriate signals about when we actually need to urinate. Now, let me address something that might be concerning some of you: the timing of eating nuts before bed. Many people worry that eating anything before sleep might disrupt their rest or cause weight gain. However, the small amounts we're talking about, just a small handful of these nuts, actually support your body's natural nighttime repair processes. The key is understanding that these nuts provide sustained energy that helps stabilize your blood sugar throughout the night, preventing those stress hormone spikes that can wake you up. They're also rich in protein, which supports the production of growth hormone during deep sleep, the hormone responsible for repairing and regenerating our tissues. But here's something crucial I want you to understand. Not all nuts are created equal when it comes to nighttime bladder health. Some nuts, particularly those that are salted or processed, can actually worsen nighttime urination by increasing sodium intake, which makes your body retain water and produce more urine. The nuts I'm recommending should be raw or lightly roasted, without added salt or oils. Think of them as nature intended: pure, wholesome, and unprocessed. This ensures you're getting the maximum benefit from their natural compounds without any additives that might counteract their positive effects. Let me also share with you how the compounds in these nuts work together synergistically. It's not just about the individual benefits of each nut, but how they complement each other when consumed as part of a nighttime routine. The melatonin from walnuts sets the stage for sleep, while the magnesium helps relax your muscles, including those around your bladder. The selenium from Brazil nuts protects your urinary tissues from oxidative damage, while the healthy fats support hormone production. The tryptophan from almonds boosts your natural serotonin production, and the alkalizing minerals help create a more comfortable environment for your bladder. This combination creates what I like to call a perfect storm of bladder calming and sleep promoting effects that work throughout the night to keep you comfortable and rested. Now, I want to address the elephant in the room. What if you're currently taking medications for sleep or bladder control? This is where it's absolutely essential to work with your healthcare provider. Never stop or change your medications without professional guidance. These nuts can be wonderful complementary support, but they should never replace prescribed treatments without your doctor's approval. Some medications for overactive bladder can interact with certain foods or supplements, so it's important to have that conversation with your healthcare team. They can help you determine the best approach for incorporating these natural strategies into your overall health plan. Let me also talk about portion sizes, because this is where many people make mistakes. When it comes to these therapeutic nuts, more isn't necessarily better. For walnuts, we're talking about just 3 to 4 halves. For Brazil nuts, 1 to 2 nuts maximum. Remember, they're very rich in selenium, and too much can actually be counterproductive. For almonds, a small handful, about 10 to 12 nuts. The timing is also important. I recommend consuming these nuts about 1 to 2 hours before your planned bedtime. This gives your body time to digest them and begin utilizing their beneficial compounds without causing any digestive discomfort that might interfere with sleep. Some of my patients have found success in creating what they call their bedtime nut mix, combining small amounts of all 3 nuts and keeping them in a small container by their bedside. This makes it easy to maintain the routine consistently, which is key to seeing results. Consistency is absolutely crucial here. These aren't quick fixes that work overnight, though some people do notice improvements within the first week. Generally, it takes about 2 to 3 weeks of consistent use to see the full benefits as your body's systems begin to rebalance and optimize. During this adjustment period, I also recommend keeping a simple sleep and bathroom journal. Note what time you go to bed, when you eat your nuts, how many times you get up during the night, and how rested you feel in the morning. This information can be invaluable for fine-tuning your approach and can also be helpful information to share with your healthcare provider. But these nuts are just one piece of the puzzle. To maximize their benefits, there are several other lifestyle factors that can support both bladder health and sleep quality. First, let's talk about fluid timing. Many people make the mistake of drastically reducing their water intake in the evening, thinking this will prevent nighttime urination. However, this can actually make the problem worse by concentrating your urine, which can irritate your bladder. Instead, focus on staying well hydrated throughout the day and then tapering off fluid intake about 2 hours before bedtime. Second, consider your caffeine timing. Caffeine can stay in your system for 6 to 8 hours, so that afternoon coffee might be affecting your sleep more than you realize. It can also act as a mild diuretic, increasing urine production. If you're serious about improving your sleep and reducing nighttime bathroom trips, consider moving your last caffeinated beverage to before 2 p.m. Third, pay attention to your dinner choices. Foods high in sodium, sugar, or artificial additives can all contribute to bladder irritation and poor sleep quality. Focus on whole, unprocessed foods for your evening meal, and try to finish eating at least 3 hours before bedtime to allow for proper digestion. Fourth, create a consistent bedtime routine that signals to your body it's time to wind down. This might include gentle stretching, reading, or practicing relaxation techniques. The key is consistency. Doing the same calming activities each night helps train your body to recognize when it's time to sleep. Now let me address some concerns you might have about adding nuts to your evening routine. Some people worry about the calories or fat content in nuts. While it's true that nuts are calorie dense, the small portions we're discussing, less than an ounce total, provide approximately 150 calories of high-quality nutrition that actually supports your body's nighttime repair processes. The fats in these nuts are predominantly healthy unsaturated fats that your body needs for hormone production and cellular repair. Think of these calories not as empty additions to your diet, but as investments in better sleep and bladder health. Others worry about potential allergies or digestive issues. If you have known nut allergies, obviously these recommendations aren't appropriate for you, and you should work with your healthcare provider to find alternative approaches. If you're unsure about allergies or have had digestive issues with nuts in the past, start very slowly with just one type of nut, in small amounts to gauge your body's response. For those concerned about digestive comfort, choose nuts that are soaked and then gently dried, as this process makes them easier to digest. You can do this at home by soaking raw nuts in water for several hours, then drying them in a low oven or dehydrator. Let me also share some additional benefits you might notice as you incorporate this nighttime nut routine. Many of my patients report improved mood and energy levels during the day, which makes sense given that better sleep naturally leads to better daytime functioning. Some also notice improvements in their skin health and appearance. The antioxidants and healthy fats in these nuts support cellular repair throughout the body, and much of this repair work happens during sleep. When you're sleeping better and providing your body with quality nutrients, it shows in your complexion and overall vitality. Others report better cognitive function and memory. Sleep is when our brain consolidates memories and clears out cellular waste, so improving sleep quality naturally supports brain health. The omega-3 fats in walnuts specifically support brain function and may help protect against cognitive decline. Now, I want to address what happens if you don't see immediate results. Some people expect dramatic changes within the first few days, but remember, we're working with natural compounds that need time to build up in your system and create lasting changes. If after 4 weeks you haven't noticed any improvement, don't give up. Instead, consider what other factors might be contributing to your sleep and bladder issues. Are you taking medications that might be affecting your symptoms? Are you dealing with high stress levels? Do you have underlying health conditions that need attention? This is where working with a healthcare provider becomes invaluable. They can help identify other potential causes and determine whether additional interventions might be helpful. Sometimes what appears to be a simple bladder issue is actually related to other health concerns that need to be addressed. I also want to mention that while these nuts can be incredibly helpful for many people, they're not magic bullets. If you're dealing with severe overactive bladder symptoms, frequent urinary tract infections, or other concerning urinary symptoms, it's important to get proper medical evaluation to rule out underlying conditions that might need specific treatment. Conditions like diabetes, heart failure, or certain neurological disorders can all affect bladder function and sleep quality. These nuts can still be beneficial as part of a comprehensive treatment plan, but they shouldn't delay appropriate medical care for serious underlying conditions. For those who are seeing positive results, you might wonder how long you need to continue this routine. The beautiful thing about using food as medicine is that these are nutrients your body can benefit from long term, unlike medications that might lose effectiveness over time or cause side effects with prolonged use. These nuts provide ongoing nutritional support that continues to benefit your overall health. Many of my patients find that this becomes a pleasant part of their evening routine, a moment of self-care and intention setting before sleep. Some describe it as their bedtime ritual that helps them transition from the busyness of the day to the calm of nighttime. Let me also share some variations that patients have found helpful. Some prefer to blend these nuts into a small smoothie with a little unsweetened almond milk and a dash of vanilla. Others like to chop them finely and sprinkle them over a small bowl of plain yogurt. The key is finding a preparation method that you enjoy and that fits into your routine sustainably. Some patients have also found success in alternating the nuts, using walnuts one night, Brazil nuts the next, and almonds the third night, then repeating the cycle. This can be helpful if you find eating the same thing every night becomes monotonous, while still providing the beneficial compounds your body needs. As we wrap up our discussion about these remarkable nuts and their potential to transform your sleep and bladder health, I want to emphasize the bigger picture here. What we're really talking about is the power of using food as medicine, choosing natural, whole foods that support our body's innate healing and balancing mechanisms. This approach aligns with something I've observed throughout my medical career. Our bodies have incredible wisdom and healing capacity when we provide them with the right tools and support. Sometimes those tools are medications and medical procedures, and sometimes they're as simple as eating the right foods at the right time. The nuts we've discussed tonight represent just one example of how nature has provided us with compounds that can address common health challenges. Walnuts with their melatonin and omega-3s, Brazil nuts with their selenium and healthy fats, and almonds with their tryptophan and alkalizing minerals. Each offers unique benefits that work together to support your body's natural rhythms and functions. But remember, sustainable health improvements rarely come from single interventions. These nuts work best as part of a comprehensive approach to sleep hygiene and bladder health that includes proper hydration, stress management, regular gentle exercise, and attention to overall nutrition. I encourage you to think of this as the beginning of a journey toward better sleep and bladder health, not a quick fix. Be patient with yourself and your body as you make these changes. Notice not just whether you're getting up less at night, but also how you feel during the day, your energy levels, your mood, and your overall sense of well-being. Most importantly, remember that you have more control over your health than you might think. While aging does bring certain challenges, many of the sleep and bladder issues we accept as normal parts of getting older can actually be improved with the right approach. Your body has served you faithfully for decades, and it deserves the best care you can provide. Sometimes that care comes in the form of advanced medical treatments, and sometimes it comes in the form of 3 simple nuts eaten mindfully before bedtime. If you found this information helpful, I encourage you to share it with friends or family members who might also be struggling with nighttime bathroom trips or poor sleep quality. Often, the The most powerful healing happens when we support each other in making positive changes. And remember, before making any significant changes to your diet or health routine, especially if you're taking medications or dealing with chronic health conditions, always consult with your healthcare provider first. They know your individual health situation best and can help you integrate these natural approaches safely and effectively. Take care of yourselves, sleep well, and remember that small, consistent changes can lead to profound improvements in your quality of life. Sweet dreams, and here's to peaceful, uninterrupted nights ahead.